For example, in, in 2008, when everything was tanking around here, estimates were that our Latino population, that of the undocumented people in the Latino population, there was 80% unemployment. Chamberlain Elementary School was giving 100% of their kids free lunches, free breakfast, and sending home food packets over the weekend because kids were going hungry. And we'd always had sliding fee discounts for everybody, but we'd never had free care. Because we always had a sense we want some kind of engagement, whether, I mean, we can argue with whether financial engagement is a necessary component, maybe not. But we always had sought some kind of patient engagement in care. And all of a sudden, folks were dropping out of care because they couldn't afford it. And $5 for an office visit was $5 less food for their kids. And so if they had to have a choice, they were going to spend it on food. And we started seeing people dropping out of wellness care, dropping out of diabetes care, and we were devastated. And we're sitting around the lunch table staff meeting, and somebody's asking the question. And this is the only reason this question came up is because we are constantly asking and visioning questions of each other. And the question came up, so if people don't have money, what do they have? What do they have? What are the assets? We're talking about asset-based development. What are the assets? And the obvious answer was time. And so within 2 weeks, we had the More Than Money program, which was where people could volunteer anywhere in the community, and we would give them $10 an hour credit on their healthcare center bill for their volunteer activity. And all of a sudden, we saw people coming back in with care, for care, who had been drifting away. We'd had one guy who his family had a $1,000 bill. Now, when you're getting 90% discounts, a $1,000 bill in primary care, that's a lot of health care. And he would still come in, but he'd always come in kind of with his head drooping and just not very. And he and his son went off to be part of La Casa's Help a House for a week and volunteered for a week. And he came back with $1,000 worth of coupons for his health care bill. And he came in and said, "Ahora puedo pagar," with this huge grin on his face. So we knew it was working. It came out of corporate imagination and engagement about what can we do differently and what can we build this on.